So we had some questions on Facebook, and we received some emails with questions as well for you. And so one of the things that was coming up on Facebook was the idea of play dates, and are they safe? Should parents be having play dates right now, or should they not be doing that? What's the guidance for that?
So this is going to be tough for parents, and as a parent, I know that this is tough. With kids home from school, kids home from daycare, we're all climbing the walls, and we have short fuses, and we all want to get out and do stuff, especially when the weather's bad. Play dates are discouraged, and that will be a hard pill for a lot of us to swallow, but any social interaction we need to limit. And so the less interactions we have with people, even our kids, the better off we are and our community will be in the long run.
Great. And what about, there were some parents who were saying, well, I have to put my child in daycare.
So the issue here is that daycares, in many instances, are taking care of the kids whose parents are stocking the shelves, who could be driving the trucks, who could be the paramedics or the nurses, medical assistants, and doctors who are taking care of these people. And so we can't really shut down daycare. If daycares need to shut down, that's fine. But many daycares are maintaining this lifeline of our community workers that we just have to have in place.
Another question we had was if someone is going out into public, do they need to wear a mask? Will that protect them from the virus? Is that an actual replacement for social distancing?
Our advice is if you're a healthy person with a healthy immune system and you know who you are, that the most important thing you can do is to stay 6 feet away from people in the public, whether you're in the line at the grocery store or you're getting takeout from a restaurant. Keep that 6-foot distance as much as you can. If you have to get close to somebody briefly, do so just briefly, and then immediately wash your hands. Anytime you touch a public surface, wash your hands, things like that.
Okay, we also got a question from someone about tourists that were recently in town, if any of them have since reported having the virus after returning home.
That's a great question. So none that I'm aware of. If someone, let's say, did come here a week ago for vacation, and they went back to Houston, and they found out that they had a positive case, that would be reportable to their local health department and wherever they were in Houston. This is theoretical, just picking on Houston for a second. And ideally, that health department in Houston would call us through their contact tracing investigation, not us per se, but our health department. And our health department would find out where they stayed, who they had contact with.
So another question that we received by email was, where are we in weeks in relation to where California and New York is right now?
So we're experiencing as a nation what's called exponential growth in the spread of this disease. Fortunately, that's not happening here in La Plata and Archuleta County, and we're hoping to keep it that way. Will we see cases? Probably. Will we see that exponential growth where 1 in 5 people that you see in the community have it? No, probably not.
And you said that was because we
Right.
started social distancing before we had our first case,
Right.
which is kind of a key thing.
Right. So the fact that we are in a very good position as a community in that we do not, to our knowledge, have any positive cases, even though we assume and that's why we're doing social distancing. If we knew for sure there was no cases in this county, then we wouldn't need to social distance. But we're social distancing because we're assuming that there's probably a few cases out there and we're trying to limit that spread. And let me tell you, I have been amazed at the people who are doing this. The restaurants are complying. The people in the grocery stores are complying. It really is amazing how we're coming together as a community.
And then another part to that question was, what are the advantages and disadvantages of being a rural community?
So we all love Pagosa for the fact that it's isolated. That's why a lot of us came here, and that's why a lot of us stay here. And the advantages there is that we aren't exposed to a lot of the traffic of flights in and out as a major city would have. And so that means we're not getting the exposure, hopefully, that some of these larger cities have gotten. That's the advantage. The disadvantage is that if we do have an outbreak here, that we don't have we have a very limited amount of healthcare resources. We have a limited number of ventilators. We have a limited amount of limited ability to transport sick patients to other hospitals in other parts of the state if we need to. So right now I want to again emphasize that we're, as somber as the tone has been in this interview, is that things are still really good in Pagosa, and we want to do everything we can to keep them that way. And all the things that people are doing to socially distance, we need to keep doing those things. It needs to continue for days, if not weeks, or even potentially months to come, to keep this from becoming a big problem. And now's the time that we really, and I have to say I got this from my mentor in Hawaii, Dr. Mugaishi, who said basically we need to model our behavior for our children. They're watching us, and they see us do the right things, and they will model their behavior after ours. And we need to be empathetic to our neighbors. We need to make community-minded decisions. We need to make rational decisions. We need to stay calm.
Thanks for watching this edition of Local News Pagosa Springs. If you would like to see this story again, visit our website at pagosalocal.news, where you can sign up to have us deliver the news directly to your inbox. If you are interested in hosting a digital network display at your place of business, you can fill out a form on our website.